Imagine being told you have dementia, that your confusion, memory lapses, and social withdrawal are irreversible signs of cognitive decline. You're asked to prepare for the heartbreaking journey ahead, as your independence, personality, and precious memories will supposedly slip away. Your family starts making decisions about your future, perhaps discussing assisted living facilities or memory care units. But what if I told you that what you're experiencing might not be dementia at all? What if the cognitive symptoms troubling you are actually caused by something treatable and completely reversible? In this video, I'm going to reveal the shocking truth that neurologists and geriatric specialists have been discovering. A significant percentage of what's diagnosed as early or moderate dementia in older adults is actually undiagnosed depression. Even more astonishing, when properly identified and treated, many of these patients experience dramatic cognitive recovery, regaining their memories, personalities, and lives. Stay until the end, because I'll share the simple screening protocol that Stanford researchers developed that can differentiate between true dementia and depression-induced cognitive impairment with over 90% accuracy, something your doctor probably isn't using but could save your or your loved one's cognitive future. The silent epidemic. When depression masquerades as dementia, the statistics are truly alarming. According to the World Health Organization, depression affects approximately 7% of the older adult population globally, yet fewer than 3% receive proper treatment. Even more concerning, studies from major medical centers, including Johns Hopkins and Mayo Clinic, suggest that between 15 to 30% of patients referred to memory clinics for suspected dementia are actually suffering from a condition known as pseudo-dementia, caused primarily by depression. Dr. Susan Lehman, director of the Geriatric Psychiatry Division at Johns Hopkins University School of Medicine, explains, what many families and even primary care physicians don't realize is that depression in older adults often presents differently than it does in younger populations. Rather than sadness, older adults with depression frequently experience cognitive symptoms that can be virtually indistinguishable from early Alzheimer's or other dementias. This phenomenon, sometimes called depression-related cognitive dysfunction or pseudo-dementia, creates a perfect storm of misdiagnosis. Patients exhibit genuine cognitive problems, memory issues, confusion, slowed thinking, poor concentration, that standard cognitive tests may flag as dementia. Yet the root cause isn't neurodegenerative disease, but untreated depression. Why depression gets misdiagnosed as dementia. There are several reasons why depression is so frequently misdiagnosed as dementia in older adults. 1. Atypical presentation of symptoms. Unlike younger adults who typically experience depression as persistent sadness or loss of pleasure, older adults often manifest depression differently. Dr. Helen Lavretsky, professor of psychiatry at UCLA, notes, in geriatric populations, depression frequently presents with cognitive complaints rather than mood symptoms. Patients and their families rarely come in saying, "I think I'm depressed." Instead, they report memory problems, confusion, or difficulty concentrating. These cognitive symptoms can include short-term memory impairment, problems with concentration and attention, slower processing speed, executive function difficulties, apparent apathy and withdrawal, confusion, and disorientation. All of these symptoms overlap significantly with early dementia, creating a diagnostic challenge. 2. Medical bias and ageism. Unfortunately, age-related bias in healthcare significantly contributes to misdiagnosis. A survey of primary care physicians found that over 50% believed depression was a normal part of aging, a dangerous misconception that leads to underdiagnosis and undertreatment. Dr. Gary Kennedy, director of geriatric psychiatry at Montefiore Medical Center, explains, there's a pervasive but incorrect belief that cognitive decline is inevitable in older age. When an 80-year-old reports memory problems, many clinicians are quick to assume it's early dementia rather than investigating potentially reversible causes like depression. 3. Inadequate screening tools. Standard cognitive assessments used in primary care settings, such as the Mini Mental State Examination, MMSE, are designed to detect cognitive impairment, but not its cause. These tools can't reliably differentiate between cognitive symptoms due to depression versus neurodegenerative disease. It's like having a thermometer that tells you someone has a fever, but not what's causing it, says Dr. Lehman. Yet based on these simple screening tools, life-altering diagnoses are often made. The vicious cycle of misdiagnosis. Perhaps most tragically, misdiagnosing depression as dementia can create a self-reinforcing cycle. When patients believe they have dementia, they often withdraw from activities and social engagement. They may stop mentally challenging themselves. They frequently develop secondary depression about their diagnosis. The resulting isolation and inactivity further worsens cognitive function. This cycle can make depression-related cognitive symptoms progressively worse, seeming to confirm the incorrect dementia diagnosis. If you're finding this information valuable, please take a moment to subscribe to our channel and hit the notification bell. Your support helps us reach more people with this potentially life-changing information. Give this video a thumbs up if you're learning something new, and let's continue with this vital discussion. The telltale signs. How to distinguish depression from dementia. While both depression and dementia can cause cognitive impairment, there are subtle but critical differences that can help distinguish between them. 1. Onset and progression. Depression-related cognitive issues typically have a relatively rapid onset, often developing over weeks or months, frequently following a stressful life event, such as bereavement, medical diagnosis, or major life transition. True dementia usually develops much more gradually, with subtle changes occurring over years rather than months. Dr. Michelle Carlson, professor at Johns Hopkins Bloomberg School of Public Health, notes, when we see a sudden drop in cognitive function in an older adult, especially following a major life stressor, depression should be high on our list of potential causes. 2. Nature of cognitive complaints. In depression, patients often express significant concern about their memory problems, can provide detailed accounts of their cognitive failures, may perform better on formal tests than their complaints would suggest, frequently answer, "I don't know," on memory tests, rather than attempting incorrect answers. In dementia, patients often show less awareness or concern about their cognitive difficulties, have trouble articulating specific problems, perform worse on formal testing than their level of function might suggest, may confabulate, make up answers to fill memory gaps. 3. Variability of symptoms. Depression-related cognitive issues tend to fluctuate. Patients may have good days and bad days, and symptoms often worsen in the evening or when tired. True dementia typically shows a more consistent pattern of impairment across different times of day and different situations. 4th, response to support and cueing. In depression, cognitive performance often improves with prompting, cueing, or additional time. In dementia, particularly Alzheimer's, prompting and cueing typically provide minimal benefit. Dr. Aaron Ritter, director of the Memory and Cognitive Disorders Program at Cleveland Clinic, explains, one of the most telling differences is how patients respond when given extra time or prompting. Patients with depression-related cognitive issues can usually access the information with support, while those with neurodegenerative conditions generally cannot, regardless of how much help we provide. The staggering impact of correct diagnosis and treatment. The consequences of correctly identifying depression-related cognitive dysfunction instead of misdiagnosing it as dementia cannot be overstated. Studies following patients previously diagnosed with dementia who were later found to have depression show remarkable rates of recovery when appropriate treatment is provided. A groundbreaking study from the University of Illinois followed 91 older adults initially referred to memory clinics for suspected dementia. After thorough evaluation, 38% were found to have depression as the primary cause of their cognitive symptoms. Of these patients, 83% showed significant cognitive improvement following depression treatment, with over half returning to normal cognitive function within 6 to 12 months. The stories of recovery can be truly remarkable. Eleanor, 79, had been diagnosed with early-stage dementia after showing increasing confusion, memory problems, and withdrawal following her husband's death. Her children had begun discussing assisted living options when a new geriatric psychiatrist suggested treating her for depression first. Within 3 months of starting antidepressant therapy and grief counseling, Eleanor's cognitive testing had improved dramatically. 6 months later, there was no evidence of cognitive impairment at all. Dr. Gary Small, director of the UCLA Longevity Center, emphasizes the importance of proper diagnosis. I've seen patients who've been told they have irreversible dementia experience what looks like a miracle recovery once their depression is properly treated. It's not actually a miracle. It's simply the right diagnosis and treatment. The comprehensive approach to diagnosis and treatment. How can we better identify and treat depression-related cognitive dysfunction in older adults? Experts recommend a multifaceted approach. 1. Comprehensive geriatric assessment. Rather than relying solely on cognitive screening tests, older adults with cognitive complaints should receive a comprehensive assessment that includes detailed history of cognitive symptom onset and progression, thorough depression and anxiety screening, review of life stressors and transitions, complete medication review, basic, metabolic, and nutritional assessment, evaluation of sleep quality. Dr. Dilip Jeste, Distinguished Professor of Psychiatry and Neurosciences at UC San Diego, notes, a 15-minute appointment simply isn't sufficient to differentiate depression from dementia. We need to look at the whole person, their medical history, life circumstances, psychological well-being, and cognitive function to make an accurate diagnosis. 2. The Depression Dementia Differential Protocol. Researchers at Stanford have developed a specialized assessment protocol that helps differentiate depression-related cognitive dysfunction from true neurodegenerative conditions. Key elements include serial cognitive testing over multiple sessions, assessment of cognitive function at different times of day, evaluation of response to cueing and support, detailed screening for vegetative symptoms of depression, evaluation of effort and motivation during testing. This protocol has shown over 90% accuracy in distinguishing depression from early Alzheimer's disease, significantly better than standard primary care assessments. 3. Therapeutic interventions for depression-related cognitive dysfunction. When depression is identified as the primary cause of cognitive symptoms, a multimodal treatment approach typically yields the best results. Pharmacological interventions, antidepressants with minimal cognitive side effects, such as SSRIs like sertraline or escitalopram. In some cases, medications that address both mood and cognition, psychological therapies. Cognitive behavioral therapy, adapted for older adults. Problem-solving therapy, interpersonal therapy, particularly for grief or role transitions. Lifestyle interventions. Regular physical exercise, with emphasis on walking and resistance training. Social engagement and meaningful activities. Cognitive stimulation through appropriate challenges. Improved sleep hygiene. Nutrition optimization. Dr. Lavretsky emphasizes the importance of comprehensive treatment. Medication alone is rarely sufficient. We need to address the psychological, social, and physical aspects of depression to see full cognitive recovery. Prevention, protecting cognitive health through depression management. Beyond treatment, how can older adults and their families protect against depression-related cognitive dysfunction? Research points to several key strategies. 1. Proactive depression screening. Regular screening for depression should be part of routine health care for all older adults, particularly following major life events such as loss of a spouse or close friend, diagnosis of serious medical conditions, major transitions, retirement, relocation, etc., hospitalizations, changes in living situation or independence. 2. Maintaining social connection. Social isolation is one of the strongest risk factors for both depression and cognitive decline in older adults. Prioritizing regular, meaningful social interaction provides powerful protection. Dr. Robert Waldinger, director of the Harvard Study of Adult Development, notes, "In our 80-plus year study on aging, social connection emerged as one of the strongest predictors of both cognitive health and emotional well-being in older adults." 3. Physical activity as medicine for mind and brain. Regular physical activity, particularly walking, swimming, or gentle strength training, has been shown to be as effective as medication for mild to moderate depression in older adults, while simultaneously supporting cognitive health. A landmark study in the British Journal of Psychiatry found that older adults who engaged in regular moderate exercise had a 42% lower risk of developing depression-related cognitive symptoms over a 5-year period. 4. Purpose and meaning in later life. Maintaining a sense of purpose and engagement in meaningful activities provides powerful protection against both depression and cognitive decline. Having a reason to get up in the morning, whether it's volunteering, creating art, caring for others, or any purposeful activity, is one of the most powerful protective factors for both mental health and cognitive function in older adulthood, explains Dr. Patricia Arian, professor of psychiatry at the University of Washington. The path forward, changing how we approach cognitive complaints in older adults. The evidence is clear. We need a fundamental shift in how we approach cognitive complaints in older adults. Rather than assuming cognitive changes signify irreversible dementia, healthcare providers and families should consider the possibility of treatable conditions like depression. Dr. Lehman proposes a simple guideline. Any older adult with cognitive complaints should receive depression screening before a dementia diagnosis is made or assumed. This single step could prevent countless misdiagnoses and allow for appropriate treatment that could restore cognitive function for many. For families, Dr. Kennedy suggests, if your loved one has been diagnosed with early dementia, but also shows signs of depression, like withdrawal, sleep changes, loss of interest in previously enjoyed activities, or apparent apathy, seek a second opinion from a geriatric psychiatrist or neuropsychologist who can specifically evaluate for depression-related cognitive dysfunction. Conclusion: hope and vigilance. The revelation that a significant percentage of apparent dementia cases may actually be depression brings both responsibility and hope. It means we must be more vigilant in seeking proper evaluation for cognitive complaints in older adults. But it also means that for many, what seems like an irreversible cognitive decline may actually be treatable and reversible. As Dr. Small emphasizes, no older adult should ever receive a diagnosis of dementia without first ruling out depression and other treatable causes of cognitive impairment. The stakes are simply too high and the potential for recovery too significant to skip this critical step. For families facing cognitive changes in a loved one, remember these key points. Depression in older adults often looks different than in younger people, frequently manifesting as cognitive problems rather than obvious sadness. The onset of cognitive symptoms matters. Sudden changes following life stressors suggest depression may be involved. Seek comprehensive evaluation that includes thorough depression screening before accepting a dementia diagnosis. If depression is identified, expect that cognitive symptoms may significantly improve or even resolve completely with proper treatment. Even with a confirmed dementia diagnosis, treating coexisting depression remains crucial for maximizing cognitive function and quality of life. Thank you for watching this video. If you found it informative, please give it a thumbs up and share it with someone who might benefit from this knowledge. Remember to subscribe to our channel for more evidence-based information that could help improve quality of life for older adults. And if you or a loved one are experiencing cognitive changes, please consult with healthcare providers who specialize in geriatric mental health. The difference between the right and wrong diagnosis could quite literally change the course of someone's life. Until next time, this is a reminder that many conditions we once thought irreversible may actually be treatable. We just need to look more carefully, ask the right questions, and never give up hope.